This friend of mine, he looked really down the mouse one day and I said, "What's wrong with you?" "Oh, I got that diabetes." I said, "Well, so what?" And he said, "But it's awful." I said, "No, it's not." I said, "I've had it for 9 years." "Oh." But, you know, like he sparked up a bit, but he's still down the dumps with it.
People's perception is they get diabetes and they think they've been given a life sentence, where in fact, yes, they have a chronic disease, but it's a manageable condition.
Probably the most helpful thing that I've found in managing diabetes is having a good medical resource. And the gentleman I go to see some 4 times a year, he's been very, very helpful and practical, and he's been very caring, and he's been very thorough.
And you can talk to him?
I can talk to him, and I appreciate that greatly.
Certainly, education is paramount to understanding diabetes and how to manage it. Just going to a doctor and getting your medication without taking some responsibility for your own body and understanding what it is you have, how you manage it, there's just no substitute for education.
People with type 2 diabetes, they have a diabetes educator, they're seen by a podiatrist, they're seen by the psychologist if they need it, they have an overview by their GP. If either they're having problems with it or for some other reason that they need to be sent to an endocrinologist, well then they're then sent to the endocrinologist. So there's a whole... Oh, and a dietitian. I forgot the dietitian, my goodness.
Well, you need to be able to feel comfortable enough in telling them exactly what's going on, how it's going on, how your sugars are going, and in turn they can then help you keep on track, keep everything monitored, making sure you've got no complications, making sure you're visiting your ophthalmologist and your podiatrist and getting everything checked over, your kidneys and everything. It's essential. Without your healthcare team, I wouldn't be able to function without them.
I religiously keep my appointments. I follow their guidance and direction. I ask a lot of questions because it's my body, not theirs.
If you write it down beforehand and make yourself a little list well before you go, you'll be thinking things and you think, oh, I must ask him this. And if you jot it down and take the list with you, you usually come out feeling that you've covered everything and your mind's at ease till the next time you see your doctor.
Well, I've found that the diabetes education program at our local community assisted me immensely, especially with the qualified practitioners to talk about diabetes. And if it wasn't for the people there, possibly I wouldn't have taken the approach I have, and I'd probably be still sitting down feeling miserable with my life. If
You're missing out on something, not doing something right, and you go in there and I say, well, what'd you do? What's this? What's that? And they try and set you right.
Okay, what they're saying is, these are the symptoms. Which symptoms can I physically change? As opposed to things like age, I can't change, unfortunately, which I'd like to, hereditary and so forth. The other symptoms like improving your lifestyle, which involved diet, exercise, I can do.
I've never let diabetes take over from how I live, what I do. It's got to fit in. But being able to control my blood sugar and get that part of my life balanced has enabled me to do a lot more things than I was able to do before I had it under control.
With regards to my 3 monthly blood tests, I've now maintained an excellent level, which is 6.0, which is a standard figure. And in fact, my doctor mentioned to me if this continues over the next 6 months, he may look at possibly stopping the medication as long as I continue with my diet and my exercise. So I think there are some positives to be gained by doing what I've done, and not just doing it like on a 20% level, just going full bore ahead and looking at my goals that I want to achieve on a daily basis and a monthly basis as well. And that reflects upon the results I'm getting with my blood tests. And so that reinforces the fact that I can do it and I will continue to do it.